Good morning from wherever you are joining me this morning on Family TV and Family Radio as we get into Relationship Clinic, where we shall be discussing a very significant and sensitive topic on infertility and relationship. This is not a very easy journey to navigate, and you need a lot of empathy, a lot of sympathy, a lot of support, and also resilience. So today with me in studio, I have an expert, a doctor who's an expert in matters fertility, infertility, so if you have any questions just to ask or to engage the doctor on, then you can talk to us on our SMS number 20316 or 0786316316 for any questions that you may have for my guest this morning in studio. Karibu sana Daktari. Please introduce yourself to our audience.
Thank you very much. So my name is Dr. Egla Nyakoa.
Yes.
I'm an obstetric gynecology resident at the University of Nairobi. I also work in a fertility clinic, an IVF clinic.
Oh, wow.
Yes.
Okay. Probably to just start us off, what is infertility and how many types are there?
Okay. So infertility can be defined as inability to achieve a successful pregnancy.
Okay.
And its best definition is based on the patient's characteristics. For example, their sexual history, their age, their diagnosis. But we can say infertility is inability to conceive after 1 year of regular unprotected sexual intercourse for a woman less than 35 years. And if the woman is more than 35 years, then this duration is put at 6 months.
Okay.
So the types of infertility are two. So one would be primary infertility.
Okay.
And primary infertility means that this couple have never gotten pregnant.
Yeah.
Secondary infertility is they have gotten pregnant before, but subsequently they are unable to get a successful pregnancy.
Okay. And what would be some of the causes of, because already you've talked about age. You said, if you're younger than 35 and below, then it's 1 year, but then above that it takes longer. So what are some of the causes of, infertility?
Okay, so the causes of infertility can be classified into two, male factors and female factors. So for the female factors, infertility can arise from factors from the ovary, from the uterus, and also hormonal issues. So from the ovary, if these are ovulatory issues, and they can result from things like polycystic ovarian disease.
PCOS.
PCOS, yes, and also endometriosis can interfere with ovulation, and also hormonal issues. So there's an area in the brain that releases a hormone that signals the ovary to produce eggs. So if there's an issue, any issue in this pathway, then there'll be an issue with ovulation. In the uterus, we can have fibroids. And if fibroids are inside the cavity of the uterus or touching the cavity of the uterus, then they can result in infertility or congenital malformation of the uterus. If the uterus did not form correctly, then that can result in infertility. Also, we can have issues of age. So age is a very important factor as a cause of infertility, advancing maternal age. So I keep telling people this, when a woman is born, when a girl is born, they're born with a specific number of eggs. So these eggs, we keep losing them every month until we get towards menopause. So with age, especially above 35 years, this loss is steep. Like the rate at which these eggs are lost is very high. So number one, there's a depletion of ovarian reserve. And secondly, there's also an increase in chromosomal abnormalities that could be incompatible with life. So this couple could be unable to conceive because of advanced maternal age.
But would a genetic test probably help with the chromosomal?
Yes.
Yes. All right.
So there are genetic tests that can be done. And also during IVF, we might go into that later.
We will,
So we can test, once we fertilize the eggs, we can do a genetic screening or diagnosis on the resultant embryo, and then we are able to select the ones that are genetically okay. Yes.
You talked about endometriosis. Is adenomyosis the same as endometriosis?
No.
So, and does it affect fertility, adenomyosis?
Yes. Okay, so endometriosis is whereby the lining of the uterine cavity, there's a lining of the uterine cavity, it's called the endometrium.
Yes.
So these tissues could be growing outside the uterus. anywhere in the pelvis, in the ovaries. That is endometriosis.
Okay.
Adenomyosis is whereby this tissue of the lining of the uterine cavity is growing inside the muscle of the uterus. Yeah.
Okay.
Yeah. So it could result in infertility as well.
All right.
Yes.
Okay.
Yes. Yeah.
And so, as a woman or someone out there who's listening to us today, a man, male or female, how would they know? Are there any early symptoms? You know, like you can tell, I have a problem and I need to seek help.
Yes.
Yeah.
So for a woman who could be having symptoms of infertility,
yes.
Number one, they could be having irregular menstrual cycles. Irregular menstrual cycle could be an indication that the woman is having anovulatory cycles. Yes. So that is one.
Yeah.
Number two, if someone is having very painful menstrual periods, that could be an indication of endometriosis.
Okay.
And endometriosis can cause infertility. Or it could be an indication of pelvic inflammatory disease, which could also result in infertility.
Okay.
And just as to mention, pelvic inflammatory disease is a condition that there's infection that spreads sexually transmitted, mostly, spreads into the uterus, into the fallopian tubes, and can result into blockage of the fallopian tubes, which is one of the main causes of infertility in our setup. Okay. Yes, in a woman.
All right.
Yeah.
And for the male?
Yes, so we are... For the male, so the causes of male infertility, one could be from developmental issues.
Yes.
There's still the same center in the brain that should produce a hormone that should signal the testicles to produce sperm. Okay. If there's an issue there, so this could be caused by brain injury, brain surgery, or just developmental issues that could result in infertility. Okay. Also, at the testicular level, we could have issues affecting spermatogenesis, that's the generation of sperm. Yeah. And this could be smoking, could result in infertility. Yes. Drugs like marijuana could also cause infertility. Alcohol, excessive alcohol intake could cause infertility. And also infection of the testicle itself could cause infertility. And this infection could also still be sexually transmitted infection, like chlamydia, gonorrhea, could also cause infertility. Or viral infection like mumps. Yeah, if the testicle is, could also cause affect the testicle producing sperm. Yeah.
Oh, okay. Yes. You've talked about marijuana, and I'm glad you mentioned that, because nowadays it's like it's the norm. Our young people, so they better heed and listen to you, because I think there was even a research on that just the other day. Okay. So what are some of the tests, like, as a couple, now you've gone through all this and you've realized, yes, we have a problem here. What are some of the tests that probably you may advise or encourage people to go for, or what are they supposed to do once you've been told, now there's this? What are some of the tests? Okay, fine. So first of all, if a couple tries to conceive for 1 year, and if the woman is less than 35 years, then they should seek for help. That's because people will come to you 15 years into marriage. Now they're in their 40s, so that's late. So any couple trying to conceive 1 year if the woman is less than 35, and if, or 6 months if the woman is more than 35. So once you seek medical help, so some of the tests that can be done for the woman, first we can do some hormonal profile, whereby this we are just trying to see if there's any ovulatory issues, and also the hormonal test will also show us the ovarian reserve. So there's a test we can do that will show us the quantity of the eggs in a woman's ovaries. That is also important. Apart from the hormones, there's also a test to check the patency of the tubes, if the fallopian tubes are open. That is called the HSG. Yes. So this is a test where I know many people have had a very bad experience for those who have done it, but it's very important because it helps us evaluate the cavity of the uterus, if there's anything inside the uterus itself, and also if the fallopian tubes are open. That would be a good place to start. And then also for the man, for a woman also just a pelvic ultrasound
also,
Okay.
just to check and see how are the ovaries looking like. There's something called follicle count. There's some eggs you can see in the ovaries.
Okay.
So it can also predict ovarian reserve. Also, pelvic scan will just show are there fibroids that could be causing this infertility.
Okay.
Yes.
A blood test somewhere?
Yeah, blood test is for the hormones.
Okay.
Yes,
Okay.
blood test is for the hormones.
All
the
right.
anti-Mullerian hormone for checking ovarian reserve.
Yes.
And other hormones just to check if this person is ovulating. Also, we can also check the thyroid function tests.
Oh,
yes.
it affects the
Yes, the thyroid can affect fertility.
Oh.
So that is also part of the evaluation for the woman.
Okay.
For the man, we can do a semen analysis. That's where to start.
Yes.
And for a semen analysis, we are looking for the quality and the quantity of the sperm.
Yes.
So quantity is the sperm count.
Okay.
So we could have less than normal sperm count, that is low sperm count.
Yes.
Or we could have zero sperm count.
Oh, wow.
Yes. Sometimes you get zero sperm count.
Yeah.
And then once you get that, you can evaluate further. You can do now hormone, you can check the hormones to see also, because even for the males, the hormones can affect generation of sperm.
Okay.
And then also, for the males, you can also access the hormones as I've just mentioned.
Yes.
Yes.
Okay.
Yes.
All right.
Yeah.
But now, we've seen elderly couple or people just getting pregnant. Is it by chance or what happens?
When you say elderly, what do you mean?
Even at 51?
Okay.
Yeah. Is it spiritual? Is it what happens at that point?
So the age of menopause is around 40, above 45 years, 47,
above,
yes. Yeah. And some studies have shown above 46 years old, then chances of naturally getting pregnant are very low.
Okay.
So I wouldn't know the circumstances, but mostly maybe these people sought fertility treatment and they were able to conceive through that. Yes.
So chances are there, but
chances are very, very low.
Oh,
yes. Because now, for a woman who is 50 years old, I think I would say chances are zero because the ovarian reserve is depleted.
Yes.
And also, if in case there's any ovarian reserve, those the chromosomal abnormalities, the quality of those eggs is not something that will give you a successful pregnancy.
Okay.
Yes.
All right. Wow. Because today we are talking about infertility and relationships.
Yes.
I know you're not an expert in relationship matters, but do you think when a couple is going through, through this journey, then, communication is important?
Yeah, very.
Yeah?
Yeah. Yeah, I think infertility will definitely affect relationships, especially in our setup, in our African setup, whereby once a couple is married, 1 year later the in-laws are there asking, how far, what's going on. So it really it affects relationships. And also just as a couple or even as an individual. Because the infertility journey has a profound emotions, and psychological issues that comes to it. And one of them is grief. And what I mean by grief is these people could be mourning their dreams of being having biological children, because maybe they have gone to the doctor and they have told them your ovarian reserve is depleted, so now you need to use an egg donor or a sperm donor. So now you know most of the time we want to reproduce after ourselves, so such can really cause a lot of grief, because you're mourning your ability to get your own children. Also it can also affect people can be withdrawn from social gatherings where children are involved, from
baby showers, like that,
and in the office maybe people are talking about their children and you don't have children, so it's a very, very heavy emotional situation. And also the another thing that it can cause is depression and anxiety, especially even if you're going through the treatment, you don't know the outcome. You're thinking about, will it be successful? Because it's not even IVF itself is not 100%. So there's a lot of emotional, it's very emotional, draining emotionally, because a lot is involved. And even just the financial implication, because maybe some people cannot even afford it. And maybe the treatment that is required is IVF. And they cannot afford it. So there's no other way they are able to get pregnant. So it's very...
It definitely weighs heavily on... because already I can see that we have some engagement on our socials. And there's someone here asking, they say, how can a partner support a partner with infertility? what kind of support would they give?
Okay.
You know, yeah.
Okay. I think as a partner, once you find out that you are unable to conceive, first it could be anyone. It could be the woman, it could be the man, or it could be the both of you.
Yeah.
Because in our society, mostly the burden lies with the woman.
With the woman.
Most of the time.
Yes.
Not always, but most of the time. So it's important that as a couple, you go seek for medical help together.
Okay.
Because that helps when you got, even if it's not you with a problem.
Yeah.
It helps when both of you get assessed, and you are able to support your partner through the follow-up, the checkups. You're able to take them to the hospital and all that. And I can still see more questions, you know, and I'm glad that, you know, the audience is engaging with us. Keep engaging with us on, you know, our social lines. SMS number is 20316-316, and then also WhatsApp number 0786-316-316. And there's someone here saying, good morning, Doc. How does one handle situations like ectopic pregnancy or failed implantation, and then the legal aspect of it? What should a couple know before going through treatment? And also, does surgery of fallopian tubes help in fertility? Okay,
there are three. So first, we'll start with the ectopic. How does one handle such a situation of ectopic?
So in the event that someone has an ectopic pregnancy, of course you have to be managed in the hospital. So it depends with the extent. So if it's a ruptured ectopic, then it requires surgery and removal of that tube. But there are some ectopic pregnancies that can be managed medically, whereby now you don't have to lose the tube. But that is determined by the person evaluating you. So in the case where you have ectopic pregnancy, maybe on one side, the other tube could still be functional.
Oh, you can still get pregnant?
Yes, you can still get pregnant with one tube.
Oh, okay.
Yes. So you can still try to get pregnant naturally, but if you don't get pregnant naturally, then we can evaluate you, and if you qualify for intrauterine insemination, then we can have that treatment.
Okay.
So if you have ectopic pregnancy on one fallopian tube, it doesn't mean you cannot get pregnant using the other tube. Yes, but if you have in the event whereby you have ectopic pregnancy on both sides, then it means you subsequently
both are damaged.
Both are removed. So there are no fallopian tubes, so you will require IVF treatment. Yes.
And then does surgery help? You know, once you have a surgery, does it help?
So surgery to unblock fallopian tube. So for ectopic pregnancy, if the surgery involved removing the tubes, then definitely you require IVF treatment. But if you have blocked fallopian tubes for whatever reason, it depends with the location of the blockage. So there's a place where blockage, surgery might not work. You go in and you find it's blocked at this level, and you're unable to unblock it. But there are some levels where it's blocked and you can try and block it. And it can improve your chances of getting pregnant, maybe around 10%. Yes. But if this fallopian tube is damaged through an infective process, then the lining of this tube is also damaged. So that means this tube might not be functional, even if it's opened, might not be functional to give you a successful pregnancy. Yes.
Okay. I'm sure that people or a couple or someone, an individual who's come to you and probably with the question of how do they navigate, you know, this journey with there's guilt, there's shame. What advice do you give them, you know, in how to navigate the journey with all that going around them?
Okay, so it's very difficult, but the first thing I always advise people that come to me is it's important to seek help. First thing, first you have to accept that, for example, I got ectopic pregnancy, now I require IVF. So you have to go through the journey of accepting that diagnosis. And then secondly, you have to seek for help. The sooner you seek for help, the better. And also talk about it. I know people, this is a very sensitive matter, but you can have a support system whereby they can encourage you, or I see groups even online of people going through fertility treatments. So I think if you get such a group, you can be able to join such support groups, so that because these people understand what you're going through, they might be able to offer better support. Yes.
Or that, you know, when someone is going through that guilt or shame, they need a lot of support, you know, from the partner and even the family at large. And before we continue, probably we'll just like to answer that question that our viewer or listener had asked, and it's about the failed implantation. What happens?
Okay, so for us to say there's a failed implantation, then it means there was an IVF treatment. Yes, and then IVF was done, and then embryos were placed in the uterus, and they did not take. So when we do the pregnancy test, then we find it's negative. That happens also. So in that case, you can still do it. It doesn't mean if you have one failed implantation, you will not get pregnant subsequently. So your chances can increase with subsequent IVF treatments, and you can. As finances allow, I know it's a very expensive treatment. You can do even up to 6. Once you're done up to 6 cycles, then chances of you getting pregnant are very, very low. Yes.
Up to 6, that's quite a bit. And so what kind of support can someone get from probably family, extended family? Could it be the spouse, and even friends in general? What kind of support would they give such a person? So
the family should, or the friends or spouse should understand that this is an illness because it's a failure of your reproductive system performing its job. So it's not something you decided on yourself. So understanding that from that point will help them try and support this person in terms of be able to include them and not put pressure on them, especially the in-laws. They can put pressure on
a lot,
or church even. So just not put pressure on the person. Try to help them. In the journey. And even sometimes, I know people don't talk about this, but even fundraise for an IVF treatment. Yes, because people are always fundraising for funerals and school or some other treatment. You can help.
And why is IVF that expensive?
So IVF treatment is costly because of the complexity of this treatment. It's there's a multi-stage of this treatment. So there are several steps in this treatment. It's not just one treatment. You go and get something and go. So there's stimulation of the ovaries to produce eggs, and this we use hormones, and these hormones are very expensive. Actually, almost half of this treatment goes to that stimulation part. So there's stimulation of the ovaries, there's a follow-up, and also there's retrieval of the eggs, fertilization in the lab, culturing the embryos, embryo transfer. So all this is in that package of the treatment. And also an IVF lab is is a high technology lab that is very expensive to set up and maintain. So there are standards that are supposed to be maintained, temperatures, there's a lot. Sterility and all that. So all this is what constitutes the price, the pricing in IVF.
That's
and I think also because it's all private, that if it was maybe public, there would be some subsidies and all that. But now, as at now, IVF is all private. Yes.
And then apart from IVF, what are the other methods that doctors use just to help people in assisted reproduction?
So other treatments for infertility could include ovulation induction. So actually, for a couple who their fallopian tubes are open, ovulation is okay, the sperm count is fine, we can do ovulation induction. And ovulation induction, the woman is given some medication to stimulate her ovaries to produce 1 or 2 eggs. And then once those eggs are mature, she gets a trigger shot, an injection to cause ovulation. And then she could either have timed intercourse with the spouse, or we could do an intrauterine insemination. Yes, that's
IUI.
Yes, IUI. Yes.
So those are just 3. And are there any side effects to this treatments, from IVF to IUI and also the stimulation of ovulation?
So IVF is a bit of an invasive treatment whereby we stimulate the ovaries to produce eggs, and then these eggs are retrieved from the body, and the man produces sperm that we fertilize in the lab. So the process of stimulation, the highest complication in IVF is ovarian hyperstimulation syndrome. But that occurs rarely, and the fertility experts are able to manage it. The rest
that means having multiple births, or
no?
What?
When you say ovarian hyperstimulation syndrome, is where these ovaries produce too many eggs, and therefore there are some effects to that.
Oh, okay.
Yes, yes. But this can be managed. Yeah, it can be managed or prevented.
Okay.
So it's one of the most, the highest complication in IVF. But the rest of the complications, just the injection, you know, like the injection, these are hormones. There's a bit of weight gain because of water retention.
Yes.
There's constipation, mood swings.
Okay.
Yes.
But how about post? Because here I'm seeing a lot of you know, medicines or whatever is used going into the mother, especially, isn't it? So post getting this baby. Are there any side effects? Can you breastfeed? Is it a normal?
Yes. So I always say the difference between IVF and natural conception is just how the conception occurred. In IVF, the conception occurred outside the body, but then we got the embryo, put it back in the body. And natural conception occurred inside the body. That's the difference. The rest of the pregnancy is similar, should be managed the same. Even delivery, you don't have to be a cesarean delivery. There's no indication. You can deliver a normal delivery. Just that people feel like this is a very precious pregnancy because you've really looked for it. Then they feel like it's safer just to do a cesarean delivery. But the rest of it is still the same as just a natural conception. Yes, and even if it's a pregnancy with an egg donor, it's still your baby. You still breastfeed the baby. You still
Talk of an egg donor. What does that involve? Because I know that's something I was coming to. But you know, what does it involve? Egg donor, can it be from anyone, or you know, how does it work?
Okay, so I'll start a bit behind. So most women that require egg donor, most women that come for IVF treatment are maybe in their early 40s or late 30s. So at this time, as we had just said earlier, that there's depletion of ovarian reserve with age. So you get, once you do the evaluation and you find this person has depleted ovarian reserve. So you cannot stimulate their ovaries to produce eggs because the eggs are depleted. So in that case, this person will require to use egg donor. So egg donors are young girls, mostly between the age of 18 and 25, who are screened. They're okay to do the egg donation program. And then, so it doesn't have to be someone that you know, or someone that you are related to. Yes. It's still, anyone can just donate. So mostly what we do, we try to match just by physical appearance, how, and maybe blood group, but it's not mandatory. Yes, so anyone can just donate. Yes.
Back to relationships. Now, here's a couple, and of course, you must set boundaries because people can be so intrusive, isn't it? What are some of the ways you may advise your patients to just go about this, setting boundaries with family and friends? It's very important to set boundaries because people will always try to get into your business and they don't even understand what you're going through. So I think one of the things is only get a few people that you can share with. You don't have to share your issues with everyone, inviting them into your business because not everyone is there to support you. I think that would be very important. And also, another thing you would do to set boundaries is just to speak your mind. Like say it as it is.
Like, this is it. So that people would know they are not able to cross. I think speaking your mind is one of the things that,
Okay, and there was also a question from a viewer, and she says, good morning, Sally. I would like to ask our guest, how do you find joy together outside the fertility journey? And also, the other one he's asking is, what is her experience as she's breaking the news about fertility to a couple for the first time? So the first one, what do you do together just to keep you together, bring that joy?
I think there's a lot you can do. Things that make you happy. Like if you're someone that likes to work out or to hike, go for hikes, or whatever your hobbies, you can, together as a couple, find joy in just doing things together. And also getting a support system. That I have overemphasized. But just doing things that you enjoy together, travel together. I think those will help you just
to
be
keep
happy.
bonding.
To keep bonding. And be there for each other.
And he's also asking about the first time you're breaking the news, like,
Yeah.
you know, this is the issue
Yeah.
we have at hand.
Yeah.
How do you, you know, what is the response of the couple?
Yeah.
How do even yourself, you know, how do you feel about that?
Yeah, so it's a very delicate information. If you're giving a patient, you're telling them your ovarian reserve is depleted, and you might require to use an egg donor, or you have 0 sperm count and you might require to use a sperm donor. So you require a lot of empathy to share this information with the couple. Try to be very empathetic, try to understand the situation from their side. So, and mostly in some fertility clinics, we have even a psychologist on board.
Okay.
So that they're able to take these patients through this, the psychological aspect of this. But as a doctor, you have to be very empathetic while sharing this information, very empathetic. Yeah. You have to answer their questions and be very patient with them so that they feel supported by the doctor. By the doctor. But giving this information, it's not easy. It's not easy, by the way. It's very, sometimes it affects you emotionally as well, as a person, as a doctor. Sometimes it affects you emotionally because, and for example, this couple, maybe they require IVF and they can't afford it. They can't afford it, and you know, now
they're so desperate.
They're desperate to have a child. So such moments can be very, very devastating, even for you as a medical doctor. Yes. Yeah.
Okay. And so, what are the success rates of, you know, this treatment? That probably we talk about IVF. What is the success rate, and also IUI, and also the pills, the tablets, or, you know, what are the success?
Okay.
rates?
So for IVF. So I like to say the success rate is based on patient factors.
Yes.
So if a patient is young meaning less than 35 years, her ovarian reserve is okay, the sperm is fine. So such a couple, their success rate could be around 50 to 60%.
Wow.
It's never 100%. Okay. Yes. Okay. With IVF. But now, if a patient is 45, they want to use their own eggs. Yes. The sperm could be fine, but their success rate could be as low as 5% with IVF. Okay. For IUI, mostly for IUI, the patient has to be, the tubes are open, the sperm is okay, the ovarian reserve is okay. So that puts their chance at around 20 to 25% for IUI. Okay. Yes.
And with this treatments, what are the chances of multiple births?
Yes, that's one of the complications actually of IVF. Yeah. So mostly in this country, IVF, when we do embryo transfer, we don't transfer one embryo. Most of the time we transfer 2 embryos, and in rare occasions maybe 3. Okay. So that of course definitely puts you at a risk of getting multiple pregnancies. Right. Yes. So IVF is associated with the multiple pregnancy. Yes. Okay. We get a lot of triplets and twins. Yeah. Although our intention when we are putting more than one embryo is not to make you get twins.
It's just to increase the chances.
It's just to increase your chances. Okay. It's like probability. If this one doesn't work, then maybe this could work. Yes. And also this treatment is expensive. So doing one embryo transfer, then you come back for another embryo transfer is a bit costly. So we try to cut on the cost.
So if you have this couple and probably their desire probably is to have a boy. Yeah. Is there selection? Yes. You know, is that with the IVF? Because it looks like it's very, like you've said, high tech. Yes. Is there a way you can just say, okay, now, we can? Is it possible?
Yes,
to pick the gender?
Yes, it is possible to do gender selection. Okay. So once the embryos are fertilized, once the eggs are fertilized, these embryos can be tested. That genetic test I talked about. Yeah. At the same time, it also gives us the gender of the embryos. Okay. So we are able to know that this is male or female, and also we can have a sperm sorting machine. So sperm is either carrying X or Y. Yes, so the sperm that fertilizes with Y will give a boy. The sperm that fertilizes with X gives a girl. Yes. Okay. So we have a sperm sorting machine that can separate the X and the Y, although it's not 100%, but chances that can also be done.
Okay. Yes. That's so interesting because, you know, just picking the gender that you want, very interesting. Yeah. However, there's this issue of insurance. So you want to come and see you, and then matters fertility, the insurance says we can't deal. Why is that so? Yet this thing is so expensive.
Yeah. Unfortunately, maybe that's best answered from the insurance company. Maybe, I don't know, I wouldn't say what, but there are some few insurance companies that have a fertility package. Very few, but there are, and also some organizations that pay for their employees. Yes. And maybe these insurance companies should look into this, because this is a very costly treatment, and infertility is equally an illness, because it really affects the well-being of someone. So maybe these insurance companies should look into this.
They should
and
consider. Really, it's not an easy journey. Financial, the impact, or about insurance. The insurances, and Daktari and I here were just discussing and saying, really, the insurance guys, wherever you are, just reconsider, tafadhali. And then we move on to Daktari. There was a question, Dr. Nyakoa, that about the legal aspect, that a couple should know before they go through with the treatment. Would you like to talk about that?
Yes. So a couple should, number one, there are things called consent. Definitely you have to consent to treatment. And for IVF, there are a lot of consents that you have to, for example, consent if you're using an egg donor, for example, the couple together should consent to using that, or sperm donor. There's consent to retrieval, like all that. So you have to ensure you have consented to all the treatments, so that you're not going to a clinic and then you're given egg donor and then you did not consent to it. That could have
the baby issues. Turns out to be somebody else.
Also, legal issues. We have surrogacy, so that's a very delicate also. But we have a lot of legal issues with that. So if you're using a surrogate, for example, there has to be a lawyer involved, a lawyer in the on board to make the contracts and ensure everything is legally in the correct way. There's also another question here. There's a lady who was asking, she's called Mercy Faith, and Mercy Faith says, good morning, Sally and Daktari. What would be the right age for someone who wishes to store her eggs? I think like freezing them or something. So this is a very important question, because I keep telling people, please, if you're not getting pregnant or if you're not planning to get children early, then store your eggs. It's not because I have seen people who now require eggs and now they have to use an egg donor. So the right age, it's best if it's below 35 years. Because after 35 years, then we start having issues. So below 35, then that's a good time.
Below 35. I think
your eggs.
I think you've answered Mercy Faith's question. And also, are there any other situations that you may need to just store a patient's eggs just for whatever reason? So for example, if a patient is undergoing cancer treatment, because cancer treatment affects the ovaries and also the testicles. So it will be important that this patient stores their eggs first before they undergo the cancer treatment. Like chemotherapy, radiotherapy involving the pelvic area. Because there are all those issues of the chemo killing. Is it killing the eggs?
Killing the eggs. Yes.
Then there was also the issue we were talking about. In IVF, you can do gender selection.
Yes, we can.
Is it possible to also, there's something that is so common, people talk about timing. The ovulation period, and then you'll get a boy if is that true? Or it's just a...
So it's hypothesis that the male sperm swims faster and also dies faster. So based on this, so if you can time your ovulation even using ovulation kits. So at the ovulation period, when the egg has just been released and then you have intercourse, the male sperm could swim faster and fertilize. But this is not really scientifically proven. Are
there, now you're here, but everything is, but are there underlying factors or conditions that may affect fertility in someone? So, number one, lifestyle. I had already mentioned about alcohol, marijuana, cigarette smoking for both male and female. Can really affect your fertility. Also, obesity. So a very high BMI. So obesity is not very good for fertility for both male and female, and also undernutrition. If somebody has a very, very low BMI as well, it will also
it can also affect their fertility. Yes.
By that also, that's weighting, weight come in here, low weight and...
Yeah, like somebody is malnourished or underweight.
Yeah.
Yes.
Yeah.
That's what I'm saying.
Okay.
Low BMI.
Yeah. We've talked about the egg freezing period. Does it also work for men, or it's just for women?
Yes, men can freeze their sperm.
Oh.
And which is easier for them, because for women they have to undergo the stimulation.
Yeah.
So, and you find some people, they decide, okay, I'm going to have a vasectomy because for whatever reason. And then later, they decide, oh, I still need some more children. So in that case, before you decide, and vasectomy is a contraceptive method, so it's okay. But before you decide to do a vasectomy, maybe you can decide to freeze your sperm, so that in case, in the event that you change your mind, you have sperm that is easily
reserved somewhere.
Somewhere.
But what are the cost implications here? Is it a costly procedure as well?
So it depends. It's really based on a facility. The facility I work at, freezing of sperm, for example, is 15,000 a year. But different facilities have different rates that are very, like some, it goes up to 100,000 depending with the facility.
Oh, okay.
Yes. So you just get the facility that you can afford. Yes.
Okay.
Yeah.
Now you're here, and because you and your spouse have decided we're going to go through fertility treatment, and you go through it. What are some of the lifetime risks, prolonged use of these treatments? Are there any risks involved?
So there are no lifetime risks involved. So the medication that is used, for example, for the woman to stimulate her ovaries to produce eggs, the body will metabolize, will clear this medication from your body.
Right.
They don't last... within 6 weeks, your body should be back to normal.
Okay.
Yes.
Oh, that's okay. Then as a doctor, Dr. Nyako, I'm sure you've dealt with so many people. Any success stories?
A lot of success stories.
Nice. Light at the end of the tunnel.
Yes, a lot of success. IVF really has really helped a lot of couples.
Yeah.
And for example, when I started working in an IVF clinic, I was the first time I saw a couple came in with a baby.
Yeah.
And that was such a lovely baby.
Yeah.
And then I just had conversation with them, and the woman told me how this baby has really changed her life. Okay. And just there and then I said, okay, I think this is it. This is what I'm going to do. Yeah. And we have had so many, like, if I had my phone, I'll show you text messages. Daktari, I'm just going home with my triplets. Wow. Photos, like it
gives you that satisfaction.
It gives a lot of satisfaction when it's a success story.
Okay. Probably as we get to the end, wrapping up the program, what would be your advice to people who are navigating this journey? A couple. What would you tell them?
Okay, so for a couple that is navigating this journey of infertility, I would like to tell them that it's something that is happening. There's a lot of people going through the same journey, so they should not feel isolated, or they should not isolate themselves. Okay. And secondly, seek for help, because some people have been married for over 10 years and they didn't seek for help, and now it's late. The woman is close to 50 and all that, and there was something that could have been done. So seek for help early. Okay. Seek for help early. Okay. That's what I would say.
Fantastic. Thank you so much, Dr. Nyako, for your time, for just coming here and educating us, giving us tips and insights on how to deal with the infertility journey, just to keep our relationships going. Asante sana for coming.
Thank you very much, sir.
And my dear viewers and listeners from wherever you are, I just want to thank you also for your time, for your engagement, for talking to me and Daktari here in studio. And I hope and pray that your concerns and questions have been answered. But you can keep on talking to us on our socials, on the numbers of 20316 on SMS and WhatsApp 0786 316 316, and we'll keep engaging you. And for now, we just want to come to the end of this program and say thank you. But before we leave, we just want to appreciate our partners from wherever they are. You've always been with us, holding our hand and make us stand, and also helping us to keep Jesus on the airwaves. So I want to say thank you so much. And if you feel you want to be part of this journey of being with us and walking with us, please send the word partner to 20316 or 0786 316 316 and write the word partner. Or if you feel you're blessed to just bless us with whatever where God has touched you, please send your donations to pay bill number 316 and the account name will be your phone number. Thank you so much for joining us. Until next week, God bless you and keep you.